Recently, this young woman received a new liver. Without it, her physician says she would be dead by now.
I really had no idea how sick I was until after the transplant, and I read it in the newspaper that I only had a week to live.
This little boy, so full of life, was born with a heart defect. Barely 1 year ago, a heart surgeon saved his life with a technique that was developed in animals. Nearly every medical advance you can think of has involved research with animals. Vaccines of every type for polio, smallpox, German measles, hepatitis, and hopefully soon for AIDS. Open heart surgery, organ transplants, blood transfusions, and virtually every drug or medication you have taken has involved research with animals.
Okay, steady as a rock. The respiration and the heart rate.
There is a good reason why medical research uses animals. Many scientific studies and tests require a living system. If they didn't, we could rely on non-animal methods, such as cell cultures and computer models. But when living systems are needed, research animals take the place of human beings. Animals are the only alternative to experiments on humans.
My name is Mary Ann. I work as a veterinary nurse in a research lab. I chose to go into this field because of my love for animals, which started when I was a child. I went to school. I went to Delhi University, which is in New York State, and I got a degree in veterinary technology.
Oh, come on, Goofy. Oh, big guy. My name is Anita. I'm an animal nurse. You're a big guy, aren't you? I have a bachelor's degree in physical anthropology, where I majored in primate studies. And I have a certificate as a veterinary technician, and I've been certified by the American Association of Lab Animal Science as a technologist. Because if it's toxic to people, possibly it's going to be toxic to them also.
Do you usually try drugs to save animals?
Oh, sure. That's what we're aiming for. Yeah, all the research is geared towards bettering human life. And by studying that, we end up bettering the animal's life also. A lot of the drugs that we study in human medicine, we can use in animal medicine. So, I mean, things don't always make you sick. Don't always make the animals sick. Plus, I mean, there are a lot of animals that have diseases that are very similar to human diseases, and we call them animal models. They're models of a human disease. Nearly every medical advance you can think of has come about through animal research. Vaccines for polio, smallpox, and measles, medications for diabetes and epilepsy. In fact, every drug you've ever taken was first tested in animals. Organ transplants were made possible by animal research, and blood transfusions and kidney dialysis. All this and more has come about through animal research. There just is no other way. I get gratification from this job, especially when I can see something compared, I can see a patient result. I mean, that's perfect. We can see it done on the animal, and we can see it done on the person. I remember talking to somebody one day that works in pediatrics over in the cancer center. And I said, God, how can you do it? How can you work with these dying babies? And he said, well, I can do it. Somebody's got to do it. And he said, a lot of people can't understand how, I was euthanizing a rabbit for him at the time. A lot of people can't understand how you can do this. So you sort of, if you can do something and you believe in it, you make yourself do it.
I was born and raised in Buffalo, New York, and I started out quite a while ago in animals, right from the time I was a few years old. I got involved in the Erie County 4-H program, and I participated in the dog programs and the horses and the cattle and numerous other farm animals, and then I decided I would like to continue my education with animals. And so I decided to go for veterinary nursing. The animals in research have to be very well cared for. very well controlled as far as their health is and the environment that they live in. So you want to have the ideal conditions. And ideal conditions are working with a healthy animal and giving the proper nutrition, the proper medical care, and being in a good, clean environment. I believe the animals get the best care. They get very good care, especially in this facility. And the animals are loved. They're loved very much. They're all cared for very well, and they are loved, which I think is very important. It's because you could care for anything, but unless you have some sort of emotion toward the animal, I don't know how much it's worth it.
Come here. Come here.
The lab animal structure
Right now.
is that we have the animal caretakers, okay, and they're the ones whose their duty is to every day do the feeding and watering and cleaning of the animals.
Come on, get it.
And then there's the veterinary nurses, and we do more of the clinical work on any animals that are ill. But with the large animals, a veterinary nurse looks at them every day, looks at them for any abnormalities. Okay, steady as a rock, the respiration and the heart rate. This sheep is being used for a pharmacology study which involves the use of different drugs over a long-term basis. What she's basically being used for is to help terminally ill cancer patients who they're trying to find some very good analgesic drugs that will bring these people relief, because these people are normally in very severe pain. When you get to the smaller animals, the rodents, the caretakers, they're the ones who are, since you have so many animals in one room, it would be impossible for a veterinary nurse to go in and go through every single cage every day. So what we do is we have the animal caretakers. They're in the rooms every day, feeding and watering and cleaning.
All laboratory animal facilities are governed by federal law. Our Bible is the guide for the care and use of laboratory animals, and we must meet the strict standards of ALAC, the American Association for the Accreditation of Laboratory Animal Care. Mary Ann and myself work under the direct supervision of laboratory animal veterinarians. There are strict guidelines that we go by if there's any question that an animal is going to experience pain or discomfort.
I want to be sure that that they're really set to do this the way they say they're going to do it. They say they're going to use isoflurane.
They had asked us to do all the anesthesia for that, because they have the two people doing the actual surgery. We'll basically be running the anesthetic machine because we're going to use the inhalants.
We have a full regimen of pain-killing drugs, anesthetics, anti-inflammatory drugs, all the same types of drugs that are used in human medicine. I just wanted you to see this cat before I gave her a pill.
How long? Yeah, how long has she been here?
She came in. I report to our clinical veterinarian, who's board certified in internal medicine. So he's the one, if I have a problem that's not your typical problem, we'd go to him. And no matter what, if there's an animal that we want to treat, we'll call our vet in.
Well, let's just watch her today. Let's not give her any of the pills today. And maybe get a stool sample just to make sure she doesn't have something as simple as some worms. I think she'll be okay.
It's very difficult to work with an animal, especially an animal that you've taken care of. Then you have to euthanize the animal. And it hurts, and you cry, and you miss the animal. But if I wasn't bothered by it, and if I tried to stay away from the emotional aspects of working with the animals, then I think it would be time to leave.
Watch it. Watch it. That's my girl. Good girl. Good. We've dedicated our lives to animals. We don't want to see them suffer. We won't allow them to suffer. And for other people to think that I would just as soon sit and watch an animal in pain when I can give it the pain reliever. You won't be. You know, I just, well, I mean, I think they're warped. I would love them to come in here and go through a day with me or with anybody else that works here.
Looks like a rat.
Yep. When I go to the schools, they'll question what I'm doing. I'll explain to them what I do, and they'll question me about it, you know, and, you know, do you kill them and stuff like that, you know, do you hurt them? I mean, it's probably good for me that they question it. And I think that like I said, I know I'm proud of what I do, and I'm not ashamed of it. And if I can talk to a child, I'm not going to snow a kid. What I've tried to convey to these kids is about the future, about a future free of birth defects, cancer, heart disease, Alzheimer's disease, all of these afflictions that can rob them and me and all of us of our natural birthright.